Good morning. At this time, I call to order the meeting of the Maryland State Firemen's Association Executive Committee meeting. We will have Reverend Harry Hetz give our invocation and our pledge to the flag. Reverend, please stand if you can.
Thank you. Grace, mercy, and peace to everyone. It's written in Proverbs, the 25th chapter and the 12th verse, like the coolness of the snow at harvest time is a trustworthy messenger to those who send him. He refreshes the spirit of his master. As we gather as this MSFA Executive Committee, each of you is that messenger. It is your activities that bring hope and encouragement in the fire service. We are in unprecedented times of change in the fire service. You stand at the front line of that change. It is you who helps to guide and focus that change. It is through your work and your efforts that refreshment comes to the fire and emergency services. Stay focused, and stand firm in your calling. As we look to the holiday season, Hanukkah, Christmas, and the New Year, be refreshed. Enjoy family and fellowship and friends. Spend reflecting time on the reason for the season. As we turn to our prayer list this morning, we have Stu Carter, Darby and Kevin Bird, Randy Smith, the family of Brian Gradjasi, and Ben Kurtz and his family as they continue to mourn Ben's mother's passing. Let us pray. Our Lord and our God, as we come to your throne of mercy this morning, Father, we thank you for the merciful God that you are. We thank you for your grace and your love over us. We thank you for your divine protection over those in the fire services. They go out to protect life and property in our communities. Father, we ask that you would continue to superintend them. Be with all those who are struggling with health issues, Father, that even though they've not made the prayer list this morning, they are there. They're in our hearts, they're in our minds, they're in our spirits. And Father, we just lift them up to you for your grace, for your touch, for your comfort in their sorrow. Father, we ask for your blessing and guidance on our executive committee meeting. We ask for your wisdom to go with us. Let our decisions be favorable in your sight. And now, Lord, we come to the business of the meeting, and we thank you for travels with safe mercies as we've come. For all things we praise and thank you. Amen. Pledge of the flag. Pledge allegiance to the flag of the United States of America, to the republic, one nation, God, indivisible, liberty and justice.
Thank you, Reverend. President McRae, you're welcome. And member of the Berlin Fire Company, come forth.
Good morning. Thank you all for being here. It looks like a very great turnout. Just a reminder, Chairman Simpkins has asked that we wear face coverings during this meeting. If anybody needs one, I happen to have very highly desirable and soon to be collectible face masks.
And the price is right.
And the price is right. Please come up and help yourself. Also, a reminder from the IT team that our Wi-Fi is limited. So please go online, go to the MSFA website, download the zip file of reports to the Executive Committee, and then try to limit your use. In other words, they've asked that no surfing or going out for other personal reasons because the Wi-Fi is limited here. And again, welcome to Berlin, and I'm going to turn it over to the president of the Berlin Volunteer Fire Company.
Good morning, everybody. Thank you for coming. We enjoy hosting the executive committee. We do this about every 3 years, and we welcome you to Berlin. If there's anything we can do to make your meeting more successful, let us know. I did have one request this morning for a breakout room. We do have the conference center. That's the best place to go. It's just right across the parking lot. If a committee or you need to have some private area, just stick your head in the kitchen. One of the members will go over there and use our key fob and open the door for you. It's got rooms, tables in there, and a private conference room. So if you need that, let us know. Lunch will be served at 12. We're having fried chicken, homemade macaroni and cheese, and string beans, so a hot lunch. And we are going to go ahead and serve a hot breakfast tomorrow morning as well, just what we had this morning as well. So there'll be a hot breakfast available tomorrow. So if anything we can do to make your meeting more successful, let us know. We have some gift bags up front here for anybody that's going on the tour in town. President has those here. I don't know what our economic development director has put in there, probably a map. There might be some coupons or gift cards or something in there that she got together. Miss Reed, who is our director at the Taylor Museum, that's just one block up on the right. She's open this morning to give tours at the Taylor Museum. We welcome you to go there. She's coming special this morning to open up the museum for our guests here in Berlin. About one block past that on the left, a lot of our members here are members of the Stevenson United Methodist Church. They have their Christmas Bazaar, and that's at an angle across from Taylor Museum. And if you walk all the way through town, which is not very far, town's only 3 blocks. We're not York City here. So there's the Welcome Center, there's a little Winter Wonderland, and just a half a block past that is the Buckingham Presbyterian Church, and they're having something this morning as well. So welcome you to Berlin. There's been arrangements, the President, we've made arrangements. If you'll come back, as you walk through town, you'll see where the horse carriage rides are. You're welcome to meet back there, and they'll bring you back to the firehouse in a horse and buggy if you'd like to do that. There's no charge for any of that. So again, welcome you to Berlin. Anything we do for you today or tomorrow, we'll try to make it happen. Thank you.
Thank you, sir. I believe Second Vice President Eric is in a meeting, so we're going to move right into officers' reports. And we'll pick up with Eric when he gets back. President McRae, your report, sir.
To all the officers, on the men's side, and to all the MSFA officers, clergy, and guests. Thank everyone for attending this executive committee meeting. Whether you're in person or online, your participation is important and shows your commitment to the continued success of this organization for the benefit of the volunteer fire service in the state of Maryland. I also thank the officers and members of the Berlin Fire Company for the hospitality and hosting this executive committee meeting. On to my report. MSFA officers, committees, and staff, support staff continue to be actively engaged in running the business of the association. There have been many face-to-face meetings on the company, county association level, and among the committees. Since the last executive committee meeting, I've had the privilege to attend at least 40 fire department related events, including company and county association meetings, installations, funerals, and neighboring state conventions. The presidents and the executive director continue to talk on a regular basis and participate in virtual meetings with our partners. The MSFA is moving forward with its portion of the SAFER grant with the hiring of a full-time recruitment manager. And as of the report of this writing, we'll still recruiting for 3 regional coordinators. More on that to come in the executive director's report. I'd like to also report that we have met with the Maryland Department of Emergency Management, formerly MEMA, met with Anna Sierra and Scott Gordon. It was a very good and productive conversation, and good to know that they are open to the suggestions we put forward to them. The Maryland State Firemen's Association has done an outstanding job of serving, promoting, and advocating and representing the interests of the fire service of the state of Maryland for the past 129 years. When this organization was formed, those many years ago, our founding forefathers appropriately named this organization the Maryland State Firemen's Association, because that's who they represented. But the fire service has evolved over time to include not only fire protection, but also rescue and emergency medical services. The mission of the MSFA is clear. However, when some hear our name, they may have a different perception of what we represent and who we are. We will have discussions today of an appropriate name. And these discussions have been in the works for many years. It's important to know. But it is probably more important now than ever before that we come together and take control of our own destiny. Any name change that we may consider would not be for us, but would be for the rest of the world to know who we are and who we represent. We need to consider a name change that would be appropriate for us for the next 130 years. Now, some of you may be aware that there are outside forces pushing for a particular name change to further their own political agenda. While this is not the right decision for a name change, it does alert us to a perception issue. Okay, I truly believe that there's a renewed energy within MSFA now that we are gathering again in the same room. And I look forward to hearing the progress that is being made by each of the committees. I thank all the officers and committees for what they do for the association and its members. Respectfully submitted, former President.
Thank you, sir. The second vice president reports, the Honorable Ben Kurtz.
Thank you, Mr. Chairman. Good morning, everyone. Unfortunately, I didn't have an opportunity to send in a written report, but I do want to say also when Chaplain Hess was going over people that for prayers, also Mike Farlow's father just recently passed away, our attorney from Pittsville. And please keep Mike and his family in your prayers. As President McRae had made mention, we have several hot topics to discuss this weekend, and we need to thoroughly discuss and come to a consensus, because this definitely affects the MSFA for our 129 years, almost 130 years next year that we've been in existence. I do want to thank each and every one who reached out to me and my family during my mom's, when she had her stroke on the 1st of November. To the ladies, State Ladies Auxiliary, thank you. Malia gave me the certificate that Mom was recognized at this past convention conference for her 75 years of service. And she had it 1 week before her stroke, so she really appreciated. So Becky and to Malia and the rest of the LA MSFA officers, thank you. She loved it. She absolutely loved it. So at this time, I'm going to let Eric come on up. So, Mr. Chairman, I am done. Thank you.
Thank you, sir. Second Vice President Eric Smothers. Eric, we skipped over you for the recognition, so if you want to run through that, and then your report afterwards. Sorry, I didn't mean to load you up.
Good morning. Good morning to everyone. Trying to work the floor here and do things. I'm sure I probably missed some folks because everybody's wearing masks. Probably didn't see you because I was behind the curtain back there. So if I missed you, I apologize. So for the officers this morning, President McRae, Kurt, myself, Doyle, any other executive officers? Morning. Long, Captain Head, Captain Roth, Kate, Lynn, Executive Committee, Chairman Simpkins, Chairman Cox, Ron Block, Dayton, Kip Jewell, Lee Lutt, Charlie Simpson, Buddy. Anybody else? Past presidents, I have Bob Cumberland, Tom Mattingly, Bill Hurlock, Cox, Danny Davis, Roger Stager, Joel Cox, Mark Bilger, Richard Blair, Mike Phelps, Chuck Walker. Anybody else? Carl? Okay. Board of Trustees, Doug Alexander, Jeffrey Clements, and Tom Mattingly. Didn't get to see all the partners come in this morning, but I have our Fire Marshal, Brian Tracy, Dr. Dalbridge, Ems, Mark Bilger. Anyone else? Some folks may be online too. Mike? Committees, I have awards, Joel Cox, Budget 2, Steve Cox, Charlie Simpson, Cumberland for federal legislation, fire laws, Mark Bilger, fire prevention, life safety, Teresa, Paula Smith, FEMA, Bill Hildebrand, out-of-state coordinator, Bob Cox, dress May, public relations, Ron Watt, management, Chip Jewell, Sergeant at Arms, Cor Wood, planning, Lee Lutt, here, Joe, Trumpet, Ways and Means, Ladies Auxiliary, President Walton, Dalton, President, Junior President Betsy Marshall, Co-Chair Kathy Temple, Betsy Marshall, Conference Co-Chair, any guests that I missed? So noted. I missed anybody, just come up. No. I'm fighting my computer this morning. I'm sorry to upload my report, but I just want to echo with our president and first vice president have said as we forward. A couple of issues. One related to our name change. I think it's time to do that. Move forward. I'm sure that will provide discussion here later on this afternoon. But also in my report, I also want to point out this is a significant time of the year where we have folks that are suffering from different issues, mental crises, so forth, had a death in the family, struggling with financial Maryland Fire Chiefs letter have done an excellent article, CISM crisis. I've noted that in my report when I get it posted up there. Something that I think we need to pay particular to, that we've got to be able to help out after each other. Psychological services is not something that a lot of us reach out for or seek help assistance in a need or a time of crisis. I'll tell you, over the last couple of weeks, just in my job alone, I've probably dealt with 4 of those type of instances, some tragically from that our flight have had to deal with, and including a firefighter suicide in Frederick County. So the issues are real, that our providers are struggling, our auxiliary members are struggling. So look at crisis management across the board, inclusive of everyone in this, to include our auxiliary members as well. The vast majority of the time, the realization is not that one particular incident that our operational folks are dealing with, but it's the day-to-day issues, whether it's finances, job, children, of course, preparation, or just that loneliness. Those are really a lot of the issues that I see doing crisis management across the state. So please reach out to mental health professionals. SysCom has a 1-800 number that you can call if you need that assistance. I've noted that in my report. They're available 24 hours a day. There are multiple other entities that are around you if you need help. So don't be afraid to reach out. Very much.
Thank you, Second Vice President. Next up, the Executive Director, Kate, if you would please, make your way to a microphone, and Doyle Cox, you're in the bullpen for the next round.
Good morning, everyone. Thank you, Mr. Chairman. My report was submitted electronically. The grant interview team met with 4 individuals for 3 of the open positions, and the full-time position offer has been extended and accepted by a 20-year volunteer EMS captain from the Eastern Shore. Her name is Heather. She was supposed to be here tomorrow to meet everyone, but her daughter, who is 11 years old, unfortunately has COVID. So she is now under quarantine. So, but she sends her regrets, and she's looking forward to meeting everyone. Skip Mahan has also been selected to remain as grant admin for the new grant. And the 3 of us will be meeting this coming Tuesday with Heather coming on via Zoom, so we can just start planning and getting a 6-month action plan started. Some of the other, we have extended the application period for Eastern Shore, Western and Southern Maryland Recruitment Coordinator SAFER positions. So if you know of anyone that would be a good fit for those positions, please let us know and have them submit their resume. We did receive 1 for Western Maryland and 3 for Southern Maryland, since this report was submitted electronically, so we are moving forward. And we will be working closely with the Recruitment and Retention Committee as well as the Maryland Fire Chiefs on all of the combined efforts that the SAFER grant is going to present. I was on the Recruitment and Retention Committee call on Wednesday with the chairman and a few other members, and we had a very good open dialogue regarding where we want to go with the SAFER grant, and that would include the involvement of the Recruitment and Retention Committee. So we're excited for all of those initiatives. As you're all aware, we did receive funding this past year due to the fundraising losses that was allocated through the Relief Act of 2021. Although there are no indications that there will be a funding source in 2022, We will be sending out a worksheet to all departments to calculate their losses for 2021. So if there is a funding mechanism made available, we will be ready to have that information available to the governor's office. We don't want to wait until the last minute or not have that information available. So if your department receives that information or that worksheet, please make sure it's sent back to me in a timely manner so we can get the spreadsheet together. We continue to use the weekly reports, which has been, I believe, a great communication tool between the staff, the president's offices, and anything that's been going on across the state that all of the departments and the associations need to be aware of. So if you are not receiving the report and you would like to, please let me know. Stop by over here, give me your email address, and I'll make sure that you're copied on those reports. 2022 convention. Lynn and I just stopped by the convention center yesterday to look at the additions to the halls and to see some of the updates that they've done. They've really done a great job. We're looking forward to utilizing that space for 2022. It's going to be a little different getting some of the vendors in. You know, they've changed some of the entrance points and stuff, but I think that some of the increased space and the way that they have the layout is going to be really beneficial for us for 2022. The mail-outs will be out within the next couple of weeks. And a reminder to share with your instructors, we do have the 2022 request for proposals that is out on the convention website under instructor registration. So if you know of a class or of an instructor that would like to present in 2022 at the beach, please instruct them to go on and fill out that RFP. In my report, you'll see that a QR code was created through Linktree. So if you hover your phone in the camera mode over that QR code, all of the MSFA websites are listed on that. So it's a great tool. We're going to get decals made for all of the vehicles. So this way, anybody that is out and about, it's an easy click on your phone, and everything from the MSFA is listed there. And lastly, tags. Tags are status quo. We're up and running. They just ordered a new shipment of MSFA tags for us. So there was about a 2-week delay where we hadn't been submitting. That was this past month. But now we're back to submitting tags. Anybody has any questions or concerns, again, stop by and see Lynn or I, but everything else is running pretty smoothly. So I appreciate your time if anybody has any questions for me.
Any questions at this point? We all know where she sits, so if you need to make a personal contact, please feel free. She's not afraid of anyone in this room.
Thank you, sir.
Secretary Doyle Cox for your secretary report, and Chaplain Long, you are in the bullpen.
Thank you, Mr. Chairman. It's on, right? Okay. Report's been filed electronically. Very short. One of your action items today is the approval of the September the 18th, 19th minutes, which you should have received a copy of. To the credentials, there's been some changes made to the credential form, which is on the web page, updated, move some information around. So as you visit your companies, find them to start submitting their credentials, it will be up on the web page probably by the end of next week. So if you get that taken care of, greatly appreciated. The departments, companies, individuals that are celebrating milestone year, 25 years, 50 service. We've got some going into 125th year, 100 on up. Please let the president know so we can proper recognition out to the report. Any questions?
Any questions for the Secretary of the MSFA? Thank you, sir. Reverend Long, in the bullpen, the Ladies Auxiliary President, her report, President Becky Walton, you're in the bullpen.
Good morning. Happy Hanukkah. Merry Christmas. Happy New Year. I'm not going to sit down for my report because I want you to see my shirt I'm wearing. There's a study going on. Rutgers University got a SAFER grant and doing a study on firefighter cancer research for volunteers. Right now, I know 2 companies that are participating in this. That's Odenton and Ferndale. They want more volunteers to participate in it. There's a lot of career departments that have already been studied for cancer, but the volunteers, there's hardly any. So please, if you want the information, I'll give it to you, but they're looking for more volunteer firefighters to get in their cancer research study. Simple, you fill out a survey, and they come and take your blood and urine sample, and they go from there. It's a 30-year study, so you might not be around for 30 years, but you'll be a participant for as long as you can. Speaking about the holidays and depression stuff, I want to remind everybody that chaplains are a great resource for psychological issues. There's a essentials class coming up in February in Loudoun County, Virginia. If you want to get your chaplain in the essentials class, you can go to the Federation of Fire Chaplains, fill out the registration there. Other than that, that's all I have.
Any questions for the chaplain? Thank you. President Becky, it's your turn.
Good morning, everyone. So glad to see everybody. I'm happy to report that the Ladies Auxiliary was finally able to meet in person after 2 long years at our fall conference held in October. Very successful event. The ladies were ecstatic to be able to see each other. I'd also like to announce that the Christmas party that Joel and I will be hosting is going to be December 11th from 3 to 6 p.m. at the Prince Frederick Volunteer Fire Department, and that is open to officers, past presidents, and committee chairs. This is an open house style event, so feel free to drop in and stay as long as you'd like and enjoy some hospitality provided by us. As always, our Bessie Marshall tickets are always for sale. This is a help to you and your members, so we like the departments to support that effort as we move through the year. Our lovely Bessie Marshall chair ladies are over here collecting tickets, selling tickets, and trying to raise money for that. As always, the Ladies Auxiliary is here to support the MSFA, so if there's anything that we can do for you, please let us know. And on behalf of my husband and myself, I'd like to extend a safe and happy holiday message to everyone. I hope everyone stays safe as they travel and enjoys their family time. Thank you.
Thank you, ma'am. The Bessie Marshall ladies, please. Is it Patricia and Kathy, right? Very good. I'm getting there. Miss Fire Prevention, is she in the house? Okay, thank you.
Good morning, Mr. Chairman, Secretary's Office, your continued support, Bessie Marshall, appreciate it. Make fire service. Stats for electronic, along with my stats were sent electronic. The number of out paid, and I ask that you emphasize to your members when applying to double check that the forms are completed correct. An incorrect form both delays the review of their application and approved payment of the case. Today, we do have a raffle of 2 past convention mugs. There will be 2 drawings, 1 each of Smith Statham, 1982-83, and Charlie Raleigh, 1983-84. They are $1 per strip and is to benefit the Bessie Marshall Fund. Thank you.
Thank you, ma'am.
Is the mic on? Yeah.
USC Marshall Benefit Fund Lottery has been good since we asked you to deliver the letters with the lottery. I want to thank everyone who got those out, including ones for the LA MSFA. So as of November 1st, we have received $1,002 for the lottery, which covers 3 cases of the 7 that have been paid. We were also fortunate to receive donations from the ladies' auxiliaries at the conference, totaling $2,325. Donations from the fire companies totaled $355. We very much appreciate all the donations. Thanks to those who have purchased lottery tickets today, and I have tickets with me if anyone needs one to take with them. We want to thank you all for your continued support.
Thank you, ladies.
Questions?
MSFA reports, the Board of Trustees, Chairman Doug Alexander. Did I see Mike? Yeah, Mike Farlow's here. Yeah, you're on the bullpen.
Good morning, everyone. Fortunately, we have a pretty short trustees report this time. We haven't received any new claims since the last executive committee meeting. However, we do have one claim pending for an LODD in Waldorf. The claim paperwork hasn't been received yet, but they do have significant time until that'll have to be submitted. We'd like to pass on our condolences to the Farlow family in the passing of Mr. Essel Farlow. Mr. Farlow was one of our longtime line of duty injury recipients. Of course, father of our MSFA attorney, Mike. I'm sure the Vice President Kurtz is working on the appeals panel list. That's an ongoing project that we're working along with. We are hoping we can get some more money for our Widows and Orphans Fund this year. Fortunately, we've had discussions with the Legislative Committee just yesterday evening, and I think we're all on the same page as to what we want to do and how we're going to get there. I also would like to thank President McRae for including us in his letter to the governor earlier this year. We met briefly this morning just to see if there was anything else that had come up in the meantime, and nothing else had come to light. So with that, I'll turn it back over to you, sir. Any questions for the Board of Trustees, Chairman? Thank you. Mike? Ladies and gentlemen, I'm going to take a moment while Mike's on his way to the microphone. Within the confines of the computer that we're all quite aware of, reports are submitted. It would behoove you please to download these reports and bring them with you, or perhaps review them prior to coming. The chairmen of various committees throughout the MSFA work diligently to make notification and publications available so everyone in this room knows what's going on. So please, prior to coming to an executive meeting, download the reports or at least review the reports so you have some concept of what's being discussed here. A lot of important information is going to be discussed today and tomorrow, and if you have a little bit of insight into it, it does make a difference. Thanks for your patience, Mike.
No problem. Thank you, Mr. Chair. I think the big issue that's going to be discussed this weekend is the name change. So I do want to go over a few issues with that. In order to make a name change for the association valid, there's going to have to be an amendment to the Constitution and bylaws. It's going to have to go through the regular process of that, and we are under a time clock there, so there's going to have to be an introduction of an amendment so that that can come before the committee and then to the executive committee so that it can be placed on the ballot for the convention. Assuming a name change is adopted by an amendment to bylaws and Constitution, there are some ancillary issues that we're going to have to address that aren't huge issues, but I just want to make the executive committee and everybody else aware of those. It doesn't just happen in a vacuum. We have to report to the State Department of Assessment and Taxation with an amended charter simply to reflect the new name change. Once we do that, we have to notify the IRS so that we're in compliance with them so that they've got the right name for the organization. will have to report to the Secretary of State for Maryland because they allow us to solicit funds as a nonprofit organization. So those 3 entities have to be notified. The trademark doesn't have to be changed yet. The mark itself isn't, there's no indication that that's going to be changed, just the language around the mark. That renewal process is going to be coming up in a year or 2 anyway, so there's no need to change that outside of the regular course of the renewal process. And we do have contracts with a number of vendors that will have to amend over the course of a period of time. But the simple change of name doesn't obviate or get rid of any of those contracts. The obligations to our association are going to be the same by the other party, and our obligations to those individuals or entities are going to be the same. As we do a transition from one name to another, assuming that that happens, we'll put in all of the documents that we submit to various governmental entities that we will still, at least for a period of time, do business as the Maryland State Firemen's Association, so there's no hiccups there in terms of people suggesting that they're 2 separate entities when they're not. We'll have to notify financial institutions, but those are, again, all incidental things. We went through some of this just a few months ago when we changed to a 501c3. That could be done without an amendment to the Constitution and bylaws. This has to be an amendment to the Constitution and bylaws. The very first paragraph in the Constitution is that the name of the association is the Maryland State Firemen's Association. There's no way around an amendment. Any questions?
Now, okay. With respect to the IRS, is there a separate filing because of the 501c3 that we need to follow up on, or just a general notification take care of that? It's essentially a general notification. We're just telling them, no, it's the IRS, so it's never just a one-line thing. There's a form that you fill out that says that there's a change of name of the organization, that it wasn't done for any illicit or unlawful purpose, and that everything, and swearing and affirming that everything that was in the original application for a 501c3 is maintained under the new name. And it's fairly standard. Other questions?
Some hands in the back. Nice and loud, or come to the microphone, either one.
Come to the mic so that it can be picked up on the...
Good morning, Mr. Chairman. My name's Doug Ware. I'm the chair of Constitution Bylaws. My question is to our attorney, who's going to submit the recommendation for the change to the Constitution and Bylaws to me?
It's got to be done through the regular process, one of the member companies or any other process you all have. It can't just be in the vacuum. Somebody can't just write it out. It has to be in the process that's already in the Constitution and Bylaws for an amendment submitted.
So, Mr. Chairman, who would designate the station to make the recommendation?
It comes from a member company in good standing. So we just have to have somebody stand up, and I'm sure there's people at the table here that'll jump up if it needs to be changed.
Okay, I appreciate that.
Yes, sir. We'll keep you in the loop. Don't worry.
Thank you.
Thank you.
Thank you. Any other questions for the attorney? General questions regarding potential notifications for a potential change. We haven't changed anything yet. We have a long discussion coming, okay? Don't get jumpy. right now. Thanks, Mike.
Thank you.
Appreciate it. The parliamentarian, Kenny Bush.
On behalf of Richard Brooks and y'all, we're here to serve you.
Thank you, sir. If anyone's following on the agenda sheet, okay, page 1 is just about done. However, the hour of 10:47, I'm going to go ahead and jump into partners reports, okay? And the first one we're going to jump into is the Emergency Medical Services branch, headed by Eric Smothers, and Dr. Is it Dr. Chismar? Dalbridge is one of them two. Your report from MIM, sir, or whatever you wish to speak to us about.
Well, this is a lot like the lightning round. Good morning, Mr. Chairman and members of the Executive Committee. So I'm Dr. Ted Dalbridge, Executive Director for the Maryland Institute of Emergency Medical Services Systems, and we would like to believe that we work closely with the MSFA, the Ems Committee on matters of import to volunteers throughout the state. I'll just update you on a couple of things. Our written report was submitted and is available on the table over there, I do believe, for folks that want more in-depth information. A couple of things, some that will be most notable to your members. One is we've done some organizational changes at MEMS over the last several weeks, and some of these are material. What was once or has been the licensure and certification department has become the Office of EMS Clinician Services to better connote our public-facing desire to be a service agency for EMS clinicians throughout the state. We have a new director of that office, Bev Whitmer, who previously was the educational program director for EMS programs at Hagerstown Community College and most recently the paramedic instructor for Howard County Fire and Rescue Services. We've made some other changes too, which was once separated into infection control and the EMRC SysCom and regional programs has become the EMS Preparedness and Operations Office, incorporating all those things. So people sometimes are looking for a report from the regional programs. We still have regional coordinators. They're the same people, but they are more integrated with what else is happening at MEMS in terms of operational emphases. What was the Office of Compliance, sort of connoting a hammer and a stick sort of approach to managing challenging situations, becomes the Office of Integrity, and what was previously hospital programs, which is responsible for accrediting or credentialing all the hospitals at things like being a trauma center or a cardiac center or stroke center, is now care integration, better connoting the effort to integrate what happens in the field with what happens in hospitals. Same people. Many of you know Jim Brown, who has been our public information officer and in charge of educational support services. Jim retired as of November 30th. I think he's been, I think they built the building around him. They built a lot of stuff around him. There's a little gathering, COVID permitting, that'll occur December 17th. It's a Friday evening. If you haven't gotten an invite and you want one, feel free to call MEMS Barb Golf. They'll tell you the particulars and more the merrier. I know just from, well, because I'm not dead yet, that the issue of the interval to transfer patients from EMS personnel to hospital personnel in our emergency departments throughout the state is a challenging and vexing issue. It's one that I'd like to tell you we're doing more than monitoring closely, and we are, but we pay attention to it every single day. It has become particularly problematic as the hospitals have been challenged with staffing shortages that include nurses and other allied health personnel. I will tell you that at the height of COVID, for example, hospitals were staffing approximately 8,400 beds in the state. Right now they're staffing about 7,800. And those are staffed inpatient beds. It doesn't account for staff that isn't working in other outpatient parts of the hospitals, including the emergency department. So the hospitals are feeling stressed. At the same time, and I'll talk more about this in a second, the number of COVID-19 patients in the state is rising again. It is really concerning and disappointing since COVID-19 is mostly now a preventable disease. We're not doing a very good job of so again, another issue for the hospital. Furthermore, the downstream things that hospitals look to do, like transfer patients out to nursing homes and places like that, are limited because those places have had staffing challenges of their own. So we did a biopsy of hospitals 10 days at the end of November, see what their situation was in terms of the necessity to board patients in the emergency department. And at any given moment in Maryland, probably somewhere between 20 and 25% of emergency department space or beds being occupied by patients who the emergency departments would characterize as boarding patients. Those are people who they have, the physician taking care of the patient in the emergency department has determined a disposition, knows the patient's going to get admitted or transferred someplace or needs a psychiatric disposition, and there's none available. So the patient's basically stuck in the emergency department. So those are spaces that ostensibly would be otherwise available to arriving EMS patients and are not. Which means the EMS personnel stand in the hallway. The 90th percentile EMS to ED transfer interval right now it stands just below 60 minutes, meaning 1 out of every 10 ambulances that takes a patient to the hospital is going to wait about 60 minutes to transfer responsibility of the care from themselves to the hospital personnel. This is information that we feed to the hospitals weekly to tell them how they're doing and remind them that we believe they have an obligation to do better. They will all acknowledge that intent. Their ability to affect that is quite variable. There are hospitals in Maryland that do an exceptional job. A couple just stand out. I talked yesterday to the base station coordinators and medical directors throughout the state and gave this spiel, so some of this data is still fresh in my mind. But places like Tidal Health Peninsula Regional, Frederick Health Hospital, Meritus, UPMC Western Maryland, Union Memorial Hospital in downtown Baltimore, they do an exceptional job of getting patients out of the hands of EMS personnel and into the hands of emergency department personnel. And some of those places represent the 5 busiest hospitals in the state. 5 busiest hospitals in Maryland for EMS arrivals: Franklin Square, Anne Arundel Medical Center, Baltimore Washington Medical Center, Frederick Health Hospital, and Johns Hopkins Bayview. Meritus is number 6, Tidal Health number 7. So busy hospitals can do a good job. It's just a matter of the hospital constructing systems to make that happen, and that's what we intend to help them do. We've been trying to do for some time. I just tell you that because I know this is a topic of interest, not only for the career services that represent bolus of patients to the hospitals, especially the metropolitan areas, but volunteers who didn't volunteer to stand up, hold on to a wall in a hospital emergency department. Do believe that sometimes we are just a little bit too passive and accept our assignment to stand against a wall for a really long period of time. I think that we could be more active and vocal in getting stuck, especially when sometimes we're called on to take care of patients in the hospital walls. I would remind EMS clinicians throughout the state that they are not credentialed to work inside hospitals. Them continue to take care of a patient inside a hospital emergency department is not their job. They are essentially augmenting hospital staff when they do that, and shouldn't. We will support anybody that does a responsible thing to affect care of a patient by hospital staff members once they've delivered the patient to their hospitals. Incurred an obligation not when they Can the online people hear me now? I thought it was squeaking there for a little bit, so I backed up. Sorry. Lost my train of thought. Well, that's that. I beat that to death. One of the things that is interesting, though, is that I think we as EMS need to do a better job. We sort of hurt ourselves. So if you're not familiar with it, you should possibly be. The dashboard that we created at MEMS called AHA, at Hospital Ambulance Dashboard. The website is like aha.mems.org/dashboard. You can look on it and you can see how many ambulances right now are at every hospital in the state. It sees all the hospitals. It doesn't see all the EMS jurisdictions. Notably, it doesn't see Allegheny County, It doesn't see the lower Eastern Shore. It sees Wacomico and Worcester, but doesn't see Somerset. Somebody else in the Eastern Shore. It doesn't see Carolina, I don't think. Maybe it does. And the reason it doesn't see those is because it relies on the CAD feed. So we get, at MEMS, we get the CAD feed for all the jurisdictions in the state except the ones that we can't currently see. It translates it into meaningful data, and it populates this AHA dashboard. So, and it can see any hospital where they go. If we've assigned the hospital a number, it sees the hospital. And it also assigns the chats alert thing to it. So on one place, and you can put it on your cell phone, you can see hospitals, how many ambulances are there, how long the ambulances have been there, most importantly. So you know if somebody's been in a hospital for 90 minutes and you go there, you're going to be there for a long time because they haven't dispositioned the one that got there 90 minutes ago. And it also, in the same field, show you if they're on red or yellow alert or whatever. But I was looking at AHA earlier this week, and there was a hospital with 10 ambulances at it. One had been there for up to almost 2 hours. The most recently got there 3 minutes ago. The one that got there 3 minutes ago had to know that they were going to be in a line with 9 other EMS units in front of them. It just occurs to me that maybe those folks could have done a better job of developing some situational awareness. And if the potential existed, and I don't know anything about the patient, so maybe that was a patient who had a long track record of care at that hospital, and that was the only place to go. But otherwise, they would have perhaps been well advised to go someplace else that was relatively nearby. And so what I'm saying is that I think we need to work this problem too. When we assign supervisory people to go to a hospital after an ambulance has been stuck there for 90 minutes, we have implicitly, ostensibly told the hospital they have 90 minutes to disposition the patient because we didn't care for the first 90 minutes. So we probably need to do a better job of helping people extricate themselves from the hospital sooner than that. And if the hospital refuses to take the report, then you tape the short form to the wall and you put the patient in a safe place and you say, call me if you have any questions, and you're out of there. And that's what I think we need to do. Okay, enough about that topic. I will tell you a couple of other things back to that topic. If you're not familiar with the directed triage protocol, that was something we implemented months ago to help EMS clinicians identify patients who might be appropriate to go to the waiting room or see the triage nurse as opposed to go to a hospital bed. Coming by ambulance doesn't automatically make you the sickest patient in the emergency department, and oftentimes the hospitals are struggling with the sickest patient in the emergency department is the one who walked through the front door. When I work in the emergency department, the patients that scare me most are guys or women who are 75 years old sitting in the emergency department with abdominal pain and a systolic blood pressure of 110. Those people are sick as a dog, potentially, and the hospital has a duty, an obligation, and a desire to put those people in the queue in front of the EMS arriving patients. So you don't want to disrupt that queue. If a patient is arriving who is appropriate to go to the hospital waiting room, EMS clinicians ought to be able to help identify those people, circumvent the whole arrival, get off the stretcher, take an hour to do that thing, take the patient to the waiting room, put him in the queue with the rest of the patients who managed to get themselves to the hospital by some other means. That is like A-OK, and we believe that every jurisdiction ought to be working with hospitals within it to make that a reality. And finally, a number of jurisdictions have begun taking patients to places other than hospital emergency departments when appropriate, specifically some urgent care centers with whom they've developed a relationship, and I'll call them crisis stabilization centers. The model's in Baltimore. A number of other jurisdictions have developed relationships with behavioral health after-hours clinics and created, well, the criteria already exist in protocol, take patients to those places and circumvent the whole arrival at the hospital, take a long time deal too. And we're interested in working with any jurisdiction that has an interest in doing that. Some have done it quite effectively. The effect isn't quite what we hope in terms of numbers all the time, but it's a worthwhile endeavor. You will remember that as part of the executive order that allowed us to do about anything we wanted in terms of responding to the pandemic, we created provisional EMS clinicians. There were about 1,200 of them. About 600 of them have converted from being provisional people to fully licensed or certified people. So that leaves about 600 to go. We know that some of them have moved out of state and so aren't going to be part of that pool. But we communicate with them often, reminding them they now have a February deadline to convert themselves or they fall off the rosters. We are going to begin communicating with the HJO for their jurisdictions where we can tell they're working based on what they've done in EMEDS. to help ensure that wherever they are is helping mentor them, make sure that by February they've done what it takes to become a fully credentialed person. And so we don't want to lose the wind in our sails of this bolus of people that we got that helped amp up the workforce. We do have some educational conferences on the books. Hopefully they'll all happen. February 18th to the 20th is Winterfest in Easton, and March 11th to the 12th is the Miltonburg Emergency Services Seminar in Flintstone. As far as I know, current planning is that those things will happen in person and live. There are some virtual options for some of the program, but we're really hoping that it'll occur. And I mentioned COVID. Again, hospitalization, I can't talk without talking about that. It's been my life for the past 18 months or so. Current, as of today, hospitalizations for COVID are 776, which represents an increase of about 30% over the past 2 weeks or so. The trajectory is not optimal. It looks like the previous surges from earlier in the winter and last fall. Hopefully it won't go as high. The difference is when those surges happened, hospitals were empty, and as I told you, they were staffing many more beds than they are now. Hospitals are full. They are staffing fewer beds because of the staffing crunch they're experiencing. And so any increase in the number of COVID patients will put the hospitals in distress and therefore the EMS system. The peak of hospitalizations, by the way, was a little over 1,900. So we have a ways to go, but we don't have the same sort of wiggle room that we had. Can't miss an opportunity to remind people that they ought to be vaccinated. If you're not, give me a call. I'm happy to help. If you have questions, I'm happy to try to answer them. But and I think we did a poor job of communicating and gave people the idea that 2 vaccines meant you were fully vaccinated. This is going to be like a flu deal or tetanus. You need to be periodically updated with vaccine to maintain your immunity. The virus is going to change, just like the flu changes every year. And the interval that you'll require an updated vaccine is going to evolve too. But if you got vaccinated and you haven't gotten a booster yet, you should do that. And you should expect that there's going to be future boosters too. And I will tell you that because I know the Maryland data extraordinarily well, getting vaccinated means you have slightly greater than 10 times less chance of getting COVID than somebody who hasn't been vaccinated. In terms of ending up in the hospital or dying, it's way better than that. So being vaccinated, even though people hear, I got to get a booster, maybe that vaccine's not working, that's just really not doing great stuff, and we know they're way safe. So please do that and encourage your family and friends. Happy to try to answer any questions. And if there aren't any, that's even better.
Any questions for Dr. Dalbridge? Thank you, sir.
I did an awesome job. I'm out.
Thank you. Sorry about that. The EMS committee, Charles Simpson. Make sure I say it right, Dad, you know.
It's S-O-N. Thank you, Mr. Chairman. Charles Simpson, EMS Committee Chair. Thanks, Dr. Dalbridge, for a great report. It did pretty much cover most of what is in my report that's submitted electronically and can be accessed by the website. The EMS Committee met with Dr. Dalbridge and Mark Bilger this morning. Prior to the start of this meeting, we discussed many issues, many concerns, and a lot of good discussion took place. A couple highlights for the EMS Committee, which met, latest meeting was in Montgomery County on November 21st. The Mspac continues to review protocols and procedures for EMS clinicians throughout the state to try to keep things as safe and productive for EMS in regards to the COVID
problems, and as they continue to grow with this new variant, those situations are continually under review. Dr. Dalbridge mentioned provisionals. Remind everybody that the provisional status ends February 11th of 2022, that if they have not moved forward with their certifications, they will be decertified again. We ask that all stations look at their provisional personnel and check the certifications just to make sure everything is up and above board. There's some concerns that we want looked at there. Regarding MIFRE, MIFRE keeps us updated. We thank the MIFRE leadership for working with the committee and continuing to keep us updated as to changes in personnel, changes in the various programs that we present. Seems to be moving along very well. The Maryland State Police Aviation Vice President Smothers advised that there's 4 medics currently in the academy, and it appears that the helicopters are out there doing a good job, and we thank the Maryland State Police for being in attendance at our meetings as well. One issue that was brought up, you've heard it at least twice this morning. We continue to follow this, and we encourage stations and personnel to be aware of various health crisis, mental crisis situations that can occur and are occurring in the field amongst our clinicians, families, and so on. Please be aware of this. If you suspect, you see, you feel, you have any indication that there's a problem, get that person help. We don't need those type of problems festering and preventing those people from doing the job that they do. So passing that along. We have a program in place within the EMS committee. We're looking at coming up with some type of recognition program for our personnel that have participated in the COVID responses and COVID activity. This is something we feel that will also deal with some of this crisis management. So we're continuing to follow that, working forward with it. Some budget and financial issues that are being reevaluated, and we'll have more to report on that down the road. Dr. Dalbridge did mention the extended wait times and problems that personnel are dealing with at the hospitals. This is primarily being dealt with jurisdictionally. However, the state triage protocol that has come out hopefully will deal with some of those problems, and we're evaluating that to see how that will work as well. The next EMS committee meeting will be held on February the 6th at 1200 hours at the Kingsville Volunteer Fire Company in Baltimore County. That's all I have at this time. Mr. Chairman, any questions?
Any questions for the EMS committee chairman, Mr. Simpson? Richard, you still need a couple minutes? Okay. ALS subcommittee, we have no one. BLS subcommittee, we have no one. Mspac, no one. EMS board, no one. Our Adams County Shock Trauma, they've been trying to hook up the TV here to get her, Becky Gilmore, on Zoom. They're working on that process, so we're going to keep on moving, folks. Dan Stevens, let's get Mike Cox and Diane May, Robert Cumberland, that crowd all moving.
Good morning, Mr. Chairman. Morning, sir. When you are ready. So we have Dan is up, and Mr. Marlett, our Deputy Director, is with me. He's going to give the Micrb report for you when we're done with the Micrb report. I filed a report electronically.
Drop that thing down so they can hear you clearly.
Okay.
There you go.
Thank you. I filed a report electronically, so I'll just breeze over the one I have and then answer any questions anyone may have. Just as a reminder, the university still has the mandatory vaccine mandate in place for all staff and faculty and the students on campus. We were able to get a waiver working with Dr. Marinopoulos for the time being for our first responders due to the low number of vaccinations in that community. So those folks that attend will still have to be tested twice a week if they're attending any classes. This is only for university system properties. So if a class is held at a fire station, the rules are a little different. Or whatever the Metro Academies decide to do it, there's locations that we'll abide by. So EMTB numbers, you guys see them, that last round of pilots before we pulled the EMT out of pilot. 67% first attempt, 76 second attempt. I got a breakdown listed in the report of how many folks went out in each of the modules. We're about where the national average is for those numbers. Many changes taking place as it came out of pilot. And then just keep in mind, some of these pilots had some of the old online programs during the COVID that were still wrapping up. So that's why it's a bit of a difference from what the other ones were at the beginning. So ALS Research Program, just want everyone to know there's a new ALS Research Program we just put in place, piloted it twice, great success. So 30-hour program, we do it in 4 days, a 7.5-hour day. There's no online portion to it. It's mostly all hands-on and scenario-driven. So we got a lot of good comments about that. We did develop a rescue technician program, so 1 day, 8-hour program, and that is compliant with the Maryland protocol that we are now delivering. Our tablet testing and test item analysis program is now rolling out. We've already been doing that with the EMTB Firefighter 1, Firefighter 2 programs, but now it's extended to all programs at MIFRE. So that rollout will begin with Northeast, which had commenced just 2 nights ago. And then the Northeast region is done. That'll include the Baltimore County, Baltimore City Metro Academies. It'll move to the Upper Shore and then back up to North Central in Frederick. And then it will move there then toward Southern Maryland, Lower Shore, Western Maryland to finish that up. So all testing going forward will all be done on an electronic tablet. Actually works better for our younger group of students. They are a group that likes instant gratification, and they'll be able to have their grade within a few moments of finishing the exam. It'll be emailed to them, so works well. There is class and program information in the report. It's just what classes are in pilot, what courses were taken out of pilot, what courses are in development. I'm not going to go through them individually for the sake of time. And then what is slated for the spring to be taken place. There were some MIFRE personnel actions that took place just in the past few weeks. Some moves, some new personnel. Jack Bell, who used to be our Southern Maryland Regional Training Center coordinator, has moved to the Upper Eastern Shore. Our Northeast Regional Training Center coordinator now will be a Mr. Rudy Leonard. He's worked for us in special programs and in our ALS training program. He'll be taking over the Northeast Center. We just hired a new gentleman to run the Southern Maryland Regional Training Center, longtime fire service proponent, retiree from Prince George County, and longtime volunteer, James Key. So he has taken over at Southern Maryland. I have a new executive assistant, just if you all call into MIFRE, into the director's office. Ms. Val has retired, and Ms. Rhonda Desper has taken over as my new executive assistant. And We have the operations section. Miss April Rowe used to work at our reception desk, has moved into the operations section as an executive coordinator. And then we also have Alex Perricone, the old Northeast Regional Training Center coordinator, has now become the state programs manager. So a few moves and a couple new people into the mix. So this doesn't necessarily pertain to any of the volunteer stations in particular, but just keep in mind the National Pro Board visit for MIFRE will be coming up, and it has to be done for our reaccreditation by June. And in preparation for this, the local ATRA sites will be visited by the state ATRA site to all the training academies or local ATRAs beginning sometime in January. PDI is scheduled for today, so that's going on in College Park today. That's what Diane May is heading up for us today. So Mr. Pat again will take care of that. Mark your calendars. The Maryland weekend at the National Fire Academy is scheduled to be February 26th and 27th. And there'll be 6 different class deliveries there. There should be some pamphlets and flyers going around for that, and it's also been put out in social media. And backed by popular demand, the National Staff and Command Program is scheduled for March 6th through the 11th, and that'll be held in Annapolis. We're up to almost 1,200 exams in the Pearson View centers. And that is pretty much about it, other than the Western Maryland Capital Project continues to be underway. So I'll ask Mr. Marlette to do the MICRB report, and then we'll answer any questions.
Thanks, Mike. The MICRB met in October 14th. Actually, there's a mistake on your document. It's October 14th. There were 41 recertifications, 17 new instructors, 8 reentries, 17 evaluators, 7 new evaluators, and there were 17 that failed to recertify, and as you know, a number of these are retirements and the like. Currently have 788 instructors, 20 instructor trainers, and 272 instructor evaluators, which is very constant. I mean, that stays pretty constant throughout the years. That's all I have.
Okay, great. Okay.
Good. Dan, want to jump in?
The MIFRE Tech, Bob Cumberland, I don't think, Bob, do you have anything for us? Okay, no report. And the MSFPQB, is Mr. Howard online by any chance? Okay, we haven't had a meeting, but the work, certification work is still getting done by the staff at MIFRE. So if you have a certification, go ahead and send it in, and hopefully we'll be meeting in the not too distant future. Training committee, they have no report. They've had a chairman change there, and J.J. Lynott has taken over that committee, and my understanding is after the first of the year, we'll be having a meeting on that. We haven't met in quite a while. The safety committee, Mike, are you here? Mike told me he'd be here, but I guess he's not. But his report is filed online, and I'm not going to read it in the interest of time. But I think we've had 2 meetings since the last executive committee, and he's put a fairly extensive report that is online. The high school tech program, I filed a report, but I guess I didn't get it in time. I don't see it online, but I'll have copies here for you all, and there's copies in the back. And just briefly, I'll go through it. On the back of my report is a list. As I mentioned at the last meeting, there's a list of the current high school programs and the counties that have them, the counties that don't have them, and whether they're 1 or 2 year programs. And that's a work in progress, and we'll keep working on it. If anybody sees a problem, either give me the new data or updated data or whatever.
Probably the biggest issue right now facing the statewide programs is the mandate from the State Board of Education that all programs will be 2-year programs. And I've heard a lot of moaning and groaning on that one. And we plan to meet with the State Board of Education. I've got a call in, and it'll probably be after the first of the year now, to discuss this. One of the issues that I'm hearing is the fact that they're dictating that EMT be taught the first year of the program, which will be juniors, high school juniors. And I'll make the prediction now. I've been involved with these high school programs for almost 30 years, and juniors are a lot less mature than seniors. Seniors aren't really up there that good either, but they don't do real well with EMT. But it's EMT at the junior level is going to be a disaster, and MIFRE is going to see their fail rates go up, my prediction. And it's what a lot of the coordinators around the state that I've talked to, they agree with that. So I'm not sure what the answer is, but the other problem with the 2-year program is, and I've been involved with 2 2-year programs, one in Calvert County and one in Prince George's County, and the trouble with finding daytime instructors, and I don't want to put any words in the mouths of the director over here, but daytime instructors are tough to get, and now we're going to double the need in a lot of the counties for daytime instructors. And the other thing is, and I've experienced this in Calvert County, which I was very involved with when they switched over to a 2-year program. 2-year program requires 1,080 classroom hours, and the MIFRE classes, and I added them up there at about 5. I didn't put the 5, but I think it's 580. But so you could just about do, and some counties do all the programs in 1 year, and that's Fire 1, Fire 2, Hazmat, EMT, PEEF, Site Ops, and Vehicle and Machinery Rescue. And if you shoehorn them in, you can get it done. But what are you going to do with the other 500 and some hours? You know, and MIFRE is not going to pay somebody to babysit these kids. If MIFRE, if they aren't teaching the class, MIFRE is not going to pay them. So this is one of the problems that we've seen, and some jurisdictions are solving it by the school system providing people. And like in St. Mary's, the St. Mary's folks, they hired somebody, even though they're still on a 1-year program, but like they're looking ahead. They've hired somebody to sort of help with these programs when the MIFRE instructors aren't there or whatever. And there's some other challenges with that, and we'll talk to the state folks about that. I don't really have a whole lot of optimism that they're going to change it, but we'll at least let them know what some of the issues are around the state with some of the coordinators. And like I say, that meeting probably won't be till the first of the year now. Another issue that's come up, and actually the president of the state ladies brought it to my attention at Southern Maryland meeting at Ridge Monday night, is the high school or the College of Southern Maryland program requires certain courses that are taught by MIFRE, and right now there aren't any offered in Southern Maryland, but in their defense, I haven't met with the coordinator down there to ask for them, but I will be doing that to see if because they are classes that we've taught before. So we'll follow up on that and see if we can't get those courses offered so those young folks can get their degree from the College of Southern Maryland. COVID, we have to mention COVID anymore, but a lot of challenges with COVID, and the fire service, MIFRE, and the school systems have collaborated to work through these issues and keep the programs running for most parts. So we appreciate that. And finally, if any county doesn't have a program, needs assistance starting one, please contact us. Bobby, my wife, and I, we've been instrumental over the years in getting programs started in 5 or 6 counties. So we'd be more than happy to come out and give you our advice and opinions, and for whatever they're worth, you probably pay about as much for them as they are worth. But
we'd be happy to do that, and my email address is in this report, which I will post. So that takes care of high school programs, unless somebody has any questions or concerns. And seriously, this list on the back, I'd like to thank the folks that have helped me with this. Todd Dyke from Western Maryland and Joe Ward from Lower Shore were very helpful when I reached out to them. But if anybody has information on your county or any of the programs, please let me know, and I'll update this, because I know it's out of date and probably some inaccuracies in there. So, Mr. Chairman, that's the high school program. If anybody has any questions, I'd be happy to.
Any questions on the high school program? Thank you, gentlemen.
Okay.
Very extensive report.
There's two more committees. Rural Water Supply, Steve Berry submitted a report, and it's online, a very thorough report, I thought, and they've had some drills. Actually, one of them was Paul Sacco School in St. Mary's County hosted, or I guess the host was Mechanicsville, and I didn't know about that, so shame on me for not knowing about that. But they've had a couple other drills around the state, and they've done some classes. So hopefully we can get that committee back up and running. We didn't have a report at the last meeting, but we do have one which is online. And finally, the Standards Committee, Ken Bush is here, but I don't think he has a report. Is that correct, Ken? Just one thing to add, there is a review of two standards that is a work in progress. The results as soon as we get. Okay, thank you. That'll do it, Mr. Chairman, for us.
Thank you for all your troubles. I've had a special request from Jonathan Dayton for recruitment and retention. Jonathan, you ready? Okay, let's move up.
Good morning, Mr. Chairman. Thank you for allowing me to report. I will not be present at tomorrow's Sunday session. Like Kate had mentioned earlier, we did meet this past week. Executive Director Kate was on, as well as Mr. President was on as well, to discuss a few things that
Hold the mic up closer to you.
That the R&R committee is working on. We've been very busy the past 2 to 3 months. A few of our initiatives include hosting another boot camp, just like we did in 2019. The SAFER grant will allow us the funds to do so. Back in 2019, if you can recall, First Arriving was contracted to hold a boot camp in College Park, Maryland. It was very instrumental in allowing the volunteer recruiters to come on board and learn some additional skills to take back to their individual departments. After talking, we decided that we want to move forward with another boot camp here in the spring. We plan to do that in coordination with the Maryland recruitment weekend that usually is in April. So our plans and intentions are to host one in March, allowing the recruiters and membership coordinators to take the skills that they learn back to their departments to implement that on Maryland recruitment weekend in April. Now, one of the discussion topics that was brought up was who was going to coordinate the boot camp itself. Would that be the committee, or would that be our new statewide coordinator? It was kind of discussed and concluded that we would set the stage and groundwork as the R&R committee and present that proposal to the new coordinator once she is onboarded here in the next few weeks, and allow her to kind of take the lead on the coordination, whether that would be keeping a lot of that work in-house through the MSFA, or finding another outside business or organization to take on getting the speakers for that particular event. We're looking at doing a 2-day event that will allow us to cover a variety of different topics, to include communication, recruitment topics, retention topics, as well as some leadership courses as well. On top of that, we did talk about a mentoring program. We didn't get too in-depth just because of time, but looking at the MVFC's program that they just published about mentoring is something that's also on our radar as well. Another quick topic that was discussed, and we mentioned this several months ago, but was a R&R toolbox. So if you're not familiar, the MSFA does have a R&R toolbox located on their website. But the issue is it's not well known within the individual departments of the MSFA. So one of the items that was discussed was purchasing some actual toolbox themselves, putting in some recruitment and retention materials, and allowing the executive committee members as well as the R&R committee members to distribute those, similar to the Cancer Brag program that the Cancer Committee has, to allow individual departments and local associations to have the tools necessary that are already out there. To piggyback and just backtrack just slightly onto the boot camp is one of the initiatives that the R&R committee did this year was to launch a new social media. Of course, Kate had mentioned the use of putting our link tree QR code together, adding those decals to the MSFA vehicles. However, we also launched TikTok, and TikTok has really taken off for us in the past 3 months since our recruitment summit in Emmitsburg. The way of the future for recruiting the next generation is really hitting them where they are most known and where they spend the most time. And we're all well aware that that is on social media and on their cell phones. So getting content in front of their faces is very important to us. We did the recruitment videos back in 2018. I was fortunate enough to be a part of one of those videos and recording sessions that First Arriving did in Ocean City. However, that content is now 2 to 3 years old, so we need updated content. So with the boot camp itself, we'll include updated recruitment retention content that we can again publish on Maryland Volunteers website to give that a quick refresh, as well as put on our social media pages. And that was the bulk of our discussion. So our next discussion will be to, of course, learn and get to meet the new R coordinator for the state of Maryland, as well as talk about and help again push the particular regional coordinating positions out there so that we have regional coordinators and meet with them as well. And then we'll lay the framework as the R&R committee for those particular coordinators to allow them to run with the ideas that we have and to generate some new leads across the state of Maryland. With that, I'll end my report. It's also filed electronically, which is a little bit narrated just because of the content of our meeting being prior to this meeting this past week. I will take any questions.
Questions?
Go. No, I don't have any questions. Go ahead.
Thanks, sir.
Chip.
Go ahead, sir.
I've got Becky Waltham. No. Becky, are you online?
Making progress, it looks like.
Mr. Chairman?
Yes, sir.
Are you looking for the lady president?
No, I'm sorry. I'm looking for Becky Gilmore from Shock Trauma for her report. I know we have copies of it. Okay, I'm going to move on because it is becoming 11:35. Yeah, resource manager. Skip, can you bring your crowd up? We're looking Bill Hildebrand, Mike Berna, Dave Engel, Aviation.
One. Better than none. 2. On this time. Went online. I'm back here.
Sorry about that. We can see you.
Mr. Chairman, this is the MSFA Resource Management Branch, and we do have individuals here from the Fire Service Planning Group and from Maryland Aviation Command, and I think we have Terry on Zoom.
Jerry, we got you on Zoom? See a couple people. Okay,
That
go ahead,
may
Skip,
be.
we hope so.
Gentlemen, it's all yours.
All right.
like I say, Terry was going to do it by Zoom, so hopefully maybe a little bit later. But real quick for the Fire Service Personnel Group Committee, we have been inactive since the first part of 2020. Of course, we all know the big reason for that is COVID. And with some personnel changes and at MEMA, it was uncertain as to whether this committee was going to be used up there in the SEOC at the Fire and Emergency Services Desk. I even talked to Joel about disbanding the committee, but we're trying to, and meeting with a couple with Russ and a couple others up in there, we've decided to go ahead with it, and my report's submitted electronically. I have a timeline of just some activities that have been going on. I have sent out an email to see all those who are still interested in the committee, and 2 have not responded. 1 did respond that they were not. So I've pretty much cleaned that up, plus we've got 1 new member. We've been doing the WebEOC drills, which are had been monthly, now then they became weekly, but I try to make sure everybody is doing that. I've also asked for ideas of what this committee can be doing for the MDM to help the Fire and Emergency Services SCF when we're not activated. I have yet to get any feedback on that. Going forward, I want to have a virtual committee meeting in mid to late January, and hopefully in the first quarter of 2022, we will be having some training at the SEOC. That's my report. If there are any questions.
Any questions? Moving on.
All right. Good morning, everybody. Appreciate the opportunity to be here representing the Maryland State Police Aviation Command. My name is Jonathan Larson. I'm a first sergeant with the department, and I oversee helicopter operations here on the Eastern Shore, state of Maryland. So for our brief, let me brief out some personnel matters. The Maryland State Police currently has 6 troopers who graduated from the 152nd Academy class on July 16th. They are completing their basic field training at one of the barracks throughout the state of Maryland. These troopers are slated to join the Aviation Command, I believe, on January the 12th, 2022. At that time, they will begin their 6-month rescue technician training. There are currently 2 individuals earmarked as potential rescue technician candidates for the 153rd MSP Academy class, which started in September. The command has also identified 2 individuals with backgrounds at EMS for the 154th Academy class, slated to begin early next year, 2000. 2 rescue technicians are actively finishing up refresher training after being transferred back into the Aviation Command in July of 2021. 1 will be assigned to the Eastern Section, Trooper 6, here on the shore. The other will be assigned to the Southern Maryland Section, Trooper 7. Both will be assigned to their respective sections on January the 12th, 2022. Director of Flight Operations. The Maryland State Police Aviation Command has conducted a competitive recruitment and selection process last month to fill the vacancy. An announcement is expected later this month. HR Recruiting Officer. MSPAC selected an internal candidate from within the department to fill the vacancy. We are pleased to announce Ms. Rita Thomas started with the Aviation Command in September of 2021. Pilots in training. MSPAC hired 2 second-in-command pilots in July. Both pilots are currently completing flight training and will be assigned to, 1 will be assigned to the Cumberland Section, Trooper 5, and the second will be assigned to the Salisbury section, Trooper 4, upon completion of their final check rides. The command is currently completing a background process for 2 potential aviation maintenance technician candidates. Moving along to aircraft maintenance, 382 Mike Delta is currently undergoing a 1-year heavy inspection at MSPAC headquarters, Martin State Airport, and is expected to be complete and returned to service next week. 387 Mike Delta is currently down for scheduled maintenance at Aviation headquarters with an anticipated return to service by early next year. 383 Mike Delta is slated to be sent out for a 2-year, 300-hour inspection to a vendor in Pennsylvania later this month. 389 Mike Delta is undergoing a 4-year, 1,200-hour inspection at Sterling Helicopter near Philadelphia and is expected to return to service within the next few weeks. The remaining helicopters are all in service statewide. Ongoing projects. Whole blood program, still in the development stage and is currently being reviewed by the legal departments for all partners, all partner agencies. Included with the blood program, plans continue to fit the aircraft with pre-hospital ultrasound. The point-of-care sonography will assist flight crews in their abilities to detect life-threatening conditions and internal injuries, as well as aiding in the care decision-making process. Information garnered potentially advances and streamlines the hospital-based decision-making during the crucial first hour of patient care. MedHub Grant Project. MSPAC, U.S. Army, and the University of Maryland Shock Trauma are working together on a pilot program to test a MedHub system, which would take the vital signs from our ProPac monitors and forward them into shock trauma while we are en route with the patient. This would allow the Army to evaluate the MedHub's function under circumstances similar to when they fly wounded soldiers in theater to a field hospital. The MedHub data could be forwarded to shock trauma using the SkyTrack system, which is currently being installed in AW-139s rolling off the assembly line. The Army is interested in supporting the Maryland State Police Aviation Command with funding to upgrade the SkyTrack equipment on our aircraft and purchase the MedHub equipment. Unmanned aircraft systems. Maryland State Police Aviation Command has taken a delivery of 10 Audubon Evo 2 dual unmanned aircraft systems. Upon training and certifying 20 MSPAC sworn members in an FAA Part 107 requirements, these units deployed throughout the state to support the command's search and rescue missions. The use of the UAS is particularly beneficial instances where weather, terrain, foliage, and search times have an impact on capabilities of the helicopter. The UAS is not a replacement for the AW-139 aircraft or the great work done each and every day by our flight crews. Hoist platform. Construction for the MSPAC hoist platform at Martin State Airport Complex is slated to begin construction this winter. The hoist platform would allow both MSPAC and allied partners an opportunity to practice aerial rescue techniques without the need to use an aircraft for dynamic training. The project was put on hold last year over budgetary concerns. Monitors. The MSPAC has taken delivery of 20 new Zoll ProPac monitors. The units replaced the command's Zoll ProPac monitors, which were no longer supported by the manufacturer. These monitors will be placed in service in the near future. There's a brief summary here for missions. During the first 11 months of 2021, MSPAC crews have responded to 1,661 EMS missions, transported 1,708 patients. MSPAC responded to law enforcement calls 121 and conducted 160 search and rescue missions. Response details for each of the strategically positioned sections are depicted below, which the report has been filed. I apologize for any redundancy if it had already been submitted, but I also submitted it this morning as well. How are we doing with time? I don't want to get in the way of Eastern Shore fried chicken and...
You're getting close. If we could start to wrap it up, I have two other people to try to squeeze in.
Yes, sir. I won't go into too much detail. I will read off one of the latest hoist missions that Trooper 1 just did on November the 27th. On November the 27th, 2021, in Havre de Grace, Maryland, the crew from Trooper 6, Eastern Section, was dispatched to the Susquehanna Flats to assist locating a small fire company boat which had launched to rescue 3 waterfowl hunters. After locating the stranded fire company vessel, the crew from Trooper 1 responded to hoist 2 fire company personnel and the 3 hunters from the silt and mud-laden flats. All individuals were successfully loaded and secured into the aircraft and taken to the National Guard Armory in Havre de Grace, where Havre de Grace ambulance crews evaluated them for hypothermia. And if there's no questions for me?
Very extensive. We have Terry Thompson on Zoom. Terry, can you hear us?
I can hear you all. Can you hear me?
Yeah, barely. Scream into that thing if you have to.
Okay. Our report for the Maryland Department of Emergency Management was submitted electronically. We did host an open house back in the middle of November for legislators and the leadership from our state agency partners and locals. That was attended very well. I'm not going to go over the whole report. It's pretty clear and straight to the point. The 911 board, I have mentioned this before, continues to move forward. They're now with us at the Department of Emergency Management, and 4 counties are currently routing with the 911 Next Gen, and it looks like that there will be 4 more going live by February 2022, and there's a total of 21 of the 24 jurisdictions are funded and approved to go to the service. The 3 remaining ones are expected to select a vendor by the end of this year. One other thing. Grants department has awarded more than $27 million in preparedness grants to the state and local agencies throughout the state. This includes the fire service in that group. As Bill had mentioned early, we've had some personnel changeovers. We still, Kyle Overly, who's one of our directors in the senior leadership group, will be leaving the middle of this month, but they have not selected a replacement for that position, and they're still working on filling the other positions from us going from an agency to a department. Unless somebody's got any questions, that concludes the report, Mr. Chairman.
Thank you, Terry. Appreciate your time and waiting. Skip, anybody else you need a report from?
Yes, sir, Mr. Chairman. Bob Smith is, or Bob Phillips, excuse me, wrong time frame, is going to give the report for the fire chief. He's second vice president.
Okay. Becky Gilmore, I know you're still out there online. I'm going to get you in next. The kitchen has requested a couple extra minutes. It does smell good back there. I did go back there, but they're cooking away, so they asked for a couple minutes. So don't get upset if we don't make it by noon. It does smell good.
Mr. Chairman, President Smith with the Maryland Fire Chiefs asked me to give a report to this stead. Greetings from him.
Is your mic on?
It's on. Hello.
There you go. Kiss it.
Hey.
Attaboy.
I got more mouth than two sets of teeth. Never mind. President Bill Smith with the Maryland Fire Chiefs contacted me and asked me to give a report in his stead. Sorry he could not make it today. He sends his greetings. Just a couple things on his list here. The Maryland Fire Chiefs just had their first year of a Hall of Fame and inducted their members this past October. He wanted to remind everybody of the Leadership Training Weekend, which is next weekend here in Ocean City, Saturday the 12th and Saturday the 11th and Sunday the 12th at Clarion. And the next membership meeting will be held Saturday, January 22nd at the Maryland Fire Rescue Institute headquarters, College Park. That would be it, sir.
Anything else, Skip? Anybody?
No, sir.
Gentlemen, thank you very much. We'll step back and Becky Gilmore from R. Adams Cali Shock Trauma for your report, ma'am. And our apologies for the lateness.
Hi, can you hear me?
Barely. Don't be afraid to holler at us. We're men.
Becky, this is Terry. I can hear you loud and clear.
Yeah, I'm having some issues here, clearly. Are you able to hear me in the room?
Yes, ma'am. Thank you.
Becky, Dennis Beard, I can hear you loud and clear here, so I would think that they should be able to hear you at their end.
Okay, shall I just go ahead with my presentation?
Yes, ma'am. Go ahead.
Okay, thank you. Good morning, everybody. I apologize for the issues I'm having with my connectivity. I have the report for the first quarter of the R. Adams Cowley Shock Trauma Center for FY22. Year to date, we have admitted 1,532 shock trauma patient visits, which is a little down on where we were this time last year. The CCRU has had 287 patients come through, and the lung rescue unit remains with a 95% of average occupancy. We've also lost a few more inter-hospital transfers than we had by this time last year, with 8 ahead of there. And I'm sure you're all aware that we've seen an increase in our capacity hours. Just to let everybody know that we are reviewing every event, every lost patient that we have, and every capacity hour, and actively working on strategies to try and reduce these numbers. Transfers from non-trauma centers account for 83% of our transfers. 63% arrive by land and 37% by air. Our actual length of stay has also increased. It's up to 9.96 days, and this is slightly ahead of what was projected for this year. It's been seen that this actually reflects an increase in our case mix index, which is an indication of our case complexity. Again, we have initiatives ongoing to try and mitigate this. We are working on a discharge by noon project, trying to get as many patients as we can discharged by noon. Both our operating room and clinic volumes have also increased compared to where we were this time last year. Our hyperbaric dives have returned to our pre-pandemic numbers, 40% of these being from our inpatient population and 60% being from outpatients. The GO team has had 4 requests, 2 from Calvert County, 1 from Charles, and 1 from Talbot County. They were deployed 1 time. This is back on September the 26th, where they went to Charles County for an MVC, and that patient trauma. Organ and tissue donation from January to August 21 returned to pre-pandemic levels, and we have seen 76% compliance with this, which is above our goal of 75%. Global Outreach and Trauma Observation Program is also restarted. We have had 12 observers, 9 from North America, 1 from South America, 1 from the Middle East, and 1 from Asia. 3 of these were nursing observers, 1 was from our orthopedics department, and 8 of them were observing with our trauma teams. The Center for Injury Prevention and Policy has had 53 events so far this fiscal year, with 3,459 attendees. Many of these have been online presentations. Trauma prevention has been through the adult and teen population, through the trauma survivors, through our Minds of the Future program, and also in violence prevention. Our Ems Observer program is also running. We've had 18 observers which have come through the trauma resuscitation units and the intensive care units. We are rotating 2 students at a time through, so they get exposure to both areas. We did have an EMS broadcast which took place on the 23rd of November and was very well attended, and we are hoping to have our next broadcast coming up in February, March of next year. Thank you very much.
Any questions for shock trauma? Becky, thank you very much for standing by and being patient with us.
I got 11:57. They asked for a couple minutes, but at this time, I would like to call forward Mr. Skip Carey and Mr. Todd Smith to come before the executive committee and the membership present for messages from both gentlemen. Toss a coin, you guys argue it out, or who goes first?
Thank you, Mr. Chairman, for giving me this opportunity. After general pushing and suggesting by several of my close friends, and after talking with several individuals who have made the trip that I'm about to partake, I've decided that I'm going to announce my candidacy at this time for the position of second vice president of our great association. And any advice, counsel, or guidance is greatly accepted and welcomed.
Go ahead.
Thank you.
Take your mask off so I can hear you. Good.
Thank you, Mr. Chairman. My name's Todd Smith. I'm from Washington County. I've been involved in the fire and rescue service for the past 45 years, both as career and volunteer. Started my career, my volunteer service as a volunteer at the age of 16, like most everybody else did early, serving throughout Washington County. I've also served as second vice president for Washington County Volunteer Fire and Rescue Association. Been on the standards committee at Washington County for several years. Announcing my candidacy for second vice president, and would appreciate any help or recommendations for anything that we can help and do and make this organization better. Thank you.
Ladies and gentlemen, there you have it. Mr. Skip Carey and Mr. Todd Smith have made their announcements to run for the position of second vice president of the Maryland State Firemen's Association. At this time, I will call on the chaplain for his prayer prior to lunch. They are ready, and chaplain, yeah, well, oh, you want to give something away? As in money? While she's adjusting the mic so she can speak, I want to remind everyone tomorrow, gentlemen, ties and coats, and don't forget your Bessie Marshall Black-Eyed Susan pin, or it's going to cost you $5.
No, they're $10. 10? Yeah.
Inflation. Merry Christmas.
Okay.
Yes, ma'am.
All righty. I want to wish everybody a happy holiday season, and I want to thank you all for your donation. We collected $375. The winner's going to get $188. So the winning ticket is 359200. Danny.
We have a winner. Who is that, Danny Davis?
Yeah, winner, chicken.
Same old crowd. Reverend John Long, tell the man we're hungry.
Please join me in prayer. Almighty God, we're so thankful for this wonderful day, the chance to travel, to be here together in person and electronically. Father, we just continue to ask your blessings on this association. Father, watch after those who are answering the calls for those in trouble. And Father, protect and guide every one of them. Lord, as we get ready to break bread with each other, Father, we ask you to bless this food to nourish our bodies. And Father, bless those who have prepared it. We ask this all in your name. Amen.
We are in recess for approximately 1 hour. Thank you.